Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening. Health Matters on the button, 8:30 ITV Networks, channel 347 on the DSTV platform. And if you are streaming across the lands and over the beautiful seas, you are doing it via itvnetworks.tv. Click on live stream. We also have an active YouTube channel where we post our any of the missed ITV shows, including Health Matters. So please catch that. And then we are live on Facebook as well. So please interact with us, spread the word, tell the family. Because tonight we're going to be talking about masks. Do we wear them or not? Why do we not want to wear them? And why are we really wearing them? And what are the best masks to use? We have the answers by specialists a little bit later on. But let's get into South Africa's stats, the numbers of where COVID-19 is at. So numbers are still climbing, and we must say a lot has eased down. We are in level 1, but they're still there. Does not mean that you should not wear the masks. Social distance, even if you're having a meeting with the teacher, going back to the office, and hand sanitize wherever you can. But also be very careful with the hand sanitizer and educate yourself on how to use it around open flames as well. So our weekly wellness is up next. So let's chat to Zuhair. Zuhair Girash from Afe Healing, the founder of this brilliant organization, out and about around the world, and also holistic well-being consultant. Please do connect with them on their various social pages, Facebook and YouTube. Assalamu alaikum to you, Zuhair. What's the weather like out in the UK?
Wa alaikum salam wa rahmatullah. I think today is our official last day of summer.
Oh.
We had 22 degrees today. Tomorrow it's down to 13. So let the games begin.
What
let the COVID cases go up as well. Yeah.
Hey, what a spike down this time around. Okay,
Absolutely.
so today's topic we are looking at is to wear the masks or not. So some people are saying, listen, it's the medical reasons I don't want to wear, but there's also the whole idea of I just feel claustrophobic. How does the Afia industry look at this issue around wearing masks?
Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. As-salatu was-salamu ala ashraf al-anbiya wal-mursaleen wa ala alihi wa sahbihi ajma'in. Alhamdulillah, this is such a debate, subhanallah, that's been going on. You know, from the beginning of the year up till today, we've had consecutively changing opinions on this matter. We started off with the World Health Organization saying that the mask does nothing, to then saying that, well, it might help if the person who's got COVID to wear it, and then it's not, and then the government saying, well, okay, now you need to wear it, and now, subhanallah, it's just, it's slowly being phased in. And again, alhamdulillah, I think, from a rational point of view, we need to understand that if someone is coughing and spluttering, this is a means at least by which, some of those germs can be contained. There are other theories that will say things like, if you continue to wear your mask for too long, your ears will start sticking out. I mean, that's one thing. But the other point is that you're breathing in those same, toxic fumes, your carbon dioxide is going back in. So I don't really buy that too much, because you see that, doctors and surgeons and nurses have been wearing their masks for years in hospitals. Okay, they're in very confined environments, very hot and humid, but they wear these things all the time, and they don't just fall dead or, contract any other complications. So I think we need to really be balanced in the way that we look at this. For example, like when you want to sneeze and cough, you're sneezing into your elbow, so at least it's a way of not transmitting those germs around. That all said, the other thing that also we look at, holistically, from a somatic point of view, is to see what the mask actually does. The mask actually covers your mouth. Okay, it's covering your nose. And at the same time, subhanAllah, when this whole movement started of, I think with Black Lives Matter, okay, and COVID and lockdown, and then the other slogan that came along with it was "I can't breathe." And this is extremely important to be able to understand is what is this mask doing for a lot of people? You know, it's sort of emphasizing this whole point of I can't breathe. So a lot of people simply by those words that are hovering in our subconscious mind, I can't breathe, feel that by putting on that mask, they can't breathe. And you know, we see, subhanallah, people who live in extremely humid climates like, you know, the Far East, in the Middle East, and they're wearing their masks. And again, it's something that people will readily adapt to. Okay, we're very flexible when it actually comes to it. So within that, what we need to understand is what is the subconscious understanding from it. A lot of the times when we muffle ourselves from a healing perspective, that usually results in all forms of issues around the throat, around the neck, around the mouth, of holding on to emotions. And so this is another thing that you know, time will only tell how badly we're affected by this whole saga, okay, of wearing a mask, of shutting up, basically. And that will only begin to manifest itself in the coming months.
Okay, so if we're really trying to, you know, understand this, and at the end of the day, it's more protection than it is actually causing any harm. And when you say shutting up, I can't breathe, how do you take yourself to the next step as well? Because some people actually suffer from, you know, claustrophobic and not breathing just because of their emotions. So let's look at understanding it and putting those words differently instead of I can't breathe, I can breathe, but...
Yeah, and well, look, when someone has a genuine medical reason, I mean, I find it extremely uncomfortable to wear a mask. Okay, I try it, and you know, it's there for the minimum time, but at some point, I just feel like, you know, pulling it down my nose so I can just take that little breath in through my nose. And so this is normal, this is natural. You know, now that the weather will get cold, I'll be quite happy to wear 3 masks if I have to, because it just keeps that warm air circulating through us.
Yeah.
But again, we just have to look at the circumstance, the environment, what is required by law. Okay, and then you just, you know, allow yourself and you pace yourself into this. You sort of get used to it. But again, when it comes down to the emotional impact that this is going to have, we can, you know, it's too early for us to actually see that impact on a global scale.
Okay, and so with Afa healing, it's not just the energy, it's the tapping. There's also breathing instances, meditation.
Yeah.
Take us through how breathing can help us while wearing the mask, and how to breathe, maybe not correctly, but also to help us breathe through the mask and still feel calm.
Yeah. Well, I mean, this is it. So the essence is that whenever we get agitated, whenever anxiety builds up, our body goes into a stress response, and that stress response gets us to start panting. And so as we start to pant, and then we realize that this air is building up around the mask, we automatically become more panicked. And then it becomes a really bad spiraling down effect from there. So the idea is really just to take gentle, deep breaths, really sort of fill up your lungs, put on the mask then, and continue to breathe gently. If at any point you feel that suffocation coming on, remove your mask, just stabilize yourself again, and then put it back on and breathe. So like we said, take a nice gentle breath in through the nose, and then just releasing it out from the mouth. And there is an extra effort, but just that conscious effort of taking in a deeper breath. And inshallah, that will start to regulate the body. And as long as the body and the mind feel safe, then we're okay with it. Inshallah, it will adjust accordingly.
What do you find that's coming through often now, besides the mask issue that's constantly changing and evolving, and now to a point where we are wearing a mask? And I know the UK, you guys have certain areas that's been locked down. Globally, on the Afia Healing pages, what is coming through often? What are you having to deal with?
Look, the main thing that's happening is the uncertainty. On a day-to-day basis, rules are changing. And especially now in the UK, that the kids have gone back to school, and suddenly the kids have been told, you shall wear masks on your way to school if you are in public transport or shared transport. That lasted a week. And then it said, okay, in communal areas, children must wear masks. Now, the third week in, they said, okay, every child must bring a mask to school. So some schools have, made it mandatory that kids wear it the whole time. Others have said, wear it in communal areas. Mm-hmm. So, this whole adjustment is taking its toll on the kids because, and even for adults, we don't know what's going on. We don't know what the rule's going to be tomorrow. Initially, it was a 14-day isolation. Mm-hmm. Now we're being told, okay, you can have 10 days and then come back. Send the kids back in. But again, it's just the unknown,
Up
and
and
that's
down.
what's building up the anxiety. That's what's building up the fear. And now, especially for us, as it gets colder, children are going to start coughing and
Yes.
spluttering. This is flu season. But then if they've got flu symptoms, go and get them tested,
Yeah.
or don't send them in, or isolate for 14 days. And again, the whole cycle breaks. We're not able to get into a routine. We're not able to get into some form of a routine that gives us stability. And as insan, we need stability. We need to be grounded. But all these, constant changing of barriers is really leaving us sort of, unearthed, subhanAllah.
Yes, and please do connect with Afia Healing and their page, and they'll tell you exactly how to become unearthed again, if I may say that. Various modalities being used to help you cope with the anxiety and the various changes. Shukran, Zuhair. All the best till we chat again next week again. Assalamu alaikum.
Assalamu alaikum.
So now moving on to our COVID-19 survivor. Tonight is Rukhshana Davids, and not just a survivor, but a paramedic. Her day-to-day job is helping to save lives. Let's find out her story as a COVID-19 survivor. Assalamu alaikum to you, Rukhshana. Rukhshana, are you with us? Yes.
Assalamu alaikum. I am, Khawa. Assalamu alaikum.
MashaAllah, lovely to see you once again, bright and shiny. Rukhshana is, as I said, a paramedic. She's got various hats. She also administers the COVID-19 support group for the health care workers and doctors, medical staff. I was chatting, as we had the show last week, we was chatting to her, and it was amazing to see the sort of support that, these individuals need, and they are literally out in a war zone. So, Rukhshana, how are you doing today, this evening? Alhamdulillah.
Alhamdulillah, Khawa, doing well. Had a hectic day today, but shukr, we carry on.
Yeah.
We're in lockdown 1, so level 1, so we're happy to be out there now.
Alhamdulillah. Okay, so quickly take us through your experience with COVID-19. I know we did chat once when you were under quarantine. You actually contracted the virus. What happened to you, and what was the sort of the process to help you recover?
Okay, so I was hospitalized in June. I've got a heart condition. I've got an underlying, I've got asthma. So I've got all the underlying conditions. And I was my cardiologist was always saying, you shouldn't get COVID, you shouldn't get COVID. But anyway, I was hospitalized, and I actually contracted COVID in the hospital. Okay, so when I got out of hospital, a week later, I felt really sick. And then my doctor said, you know what, you got to go for the test. And I said, I think I've got it, because I know all the symptoms, everything. So I went for the test, and, alhamdulillah, tested positive. And then I was quarantined from the time I came out of hospital, because I was in a hospital and I could contract the virus at any point. I was quarantined from the 30th of June up until end of July. So when I got out, I didn't see my kids for a week, and then I got the symptoms, went for the test. Obviously, it was positive. So I still couldn't see my kids. So I was all alone at the time. But, it was quite daunting. I think the hospital stay for me was quite scary. I didn't have COVID at the time, but to see all the doctors and the nurses in these PPEs and their masks, and all you see are these little eyes staring at you like a robot, and I think I'm a very positive person. I'm a very strong-willed person. And I always say, you know what, if I'm going to get it, it's because Allah wanted me to get it. So, but when you are there and you do get the call to say you're positive, immediately that fear kind of grips you. It's and you can be what a strong person, but somehow it's like you got to remind yourself, this is from Allah. You got to just take it in your stride. The fear of the media out there just created havoc. So obviously, I think that spiraled everything for me.
Being a paramedic, did it help you in any way surviving COVID-19?
It did, yes, it did, because I have the medical background almost. I could, and I seen a few patients before then, and a lot of reading on the virus. It helped me a lot in that I knew exactly what to do and how to do, and what medication to take, when to actually take my oxygen. I was given, luckily, Vision Tactical. One of the medics, Anis Kara, brought me oxygen at home, so I didn't have to go back to hospital. So being a paramedic, yes, alhamdulillah, I could see to myself. I could administer myself. I could know at what point I need to phone my doctor and say, you know what, I think my oxygen levels are low, or I didn't have a good night. This is, so at least I could give that account to my doctors, and I had the know-how. So I think it stayed me in good stead, yeah.
Okay, you spoke about hospitals, and this was something that we discussed last week, and the doctors and healthcare workers being in the front line. Was your virus managed at home? And comparing to what you saw in the hospital, is that where you would have wanted to be? How did you feel about that? Did it create some fear, inside of you, to think that if it does get to worse, this is where I'll be?
Yes, no, definitely. However, from the time I got into hospital, in the ER of Flora Clinic, I said to Dr. Ridwan Kirsten, you know what, I don't want to be here. I just want to go home. And he said, you're too sick. We can't let you go home. And his words to me afterwards was, when I was discharged, he said to me, I didn't think you were going to make it. So I'm like, wow, what do you mean? He says, I've seen patients even more healthy than you walk in, and they don't make it. Because at the time I was admitted, my heart pain was hectic, the chest pain, I couldn't breathe, I could, So what I've seen in hospital, patients next to me, when you're admitted, they keep you in what they call the PUI ward, patient under investigation. So you could at that point be laying next to a COVID patient. And you won't know until you get your results a day and a half later. And I think that's where I got it. So what I've seen, some patients were so sick, I even felt to myself, you know what, maybe I shouldn't be here, because these patients are really, really sick. One evening about 10 o'clock, they wheeled the patient in, and you could see she had COVID written all over. She was sick. She was on a ventilator. And I just said to my doctor, I messaged him, and I said, I don't think I should be in this ward with the patient, in case I don't have COVID, but I can see this woman's clearly got it. Okay, but anyway, so when I came home and I tested positive, yes, I was on my own, and I managed the virus on my own at home. And I said to the doctors, you're not admitting me again. Every day I had to do little videos to see, the doctor wanted to see my breathing and the color of my skin and my oxygen levels. So I kept my doctor updated on that, with that all the time, right? But I said to him, I'm not going back to Flora Clinic, because you're sitting in the ward there and you maybe just want to go for a walk or something, and you can't. You're confined to that space for that week, 2 weeks that you are there. The nurses, it felt very cold for me, because the nurses were, they were all in full PPE. And like I said, even the doctors, you could just see their eyes, and rightly so, because they needed to take all the precautions. But for you as a patient on the other side, it was quite scary. And like I said, I'm a very strong-willed person, but to go through that, sometimes you think to yourself, it's hectic. That fear just grips you, and you think to yourself, is this time? Is Allah sending Malikul Maut to take your ruh? But you kind of just make sure you read a lot. You speak to your family. I could, alhamdulillah, still video call my kids and my family from a hospital bed. There are patients I've seen that couldn't do that.
As a woman paramedic, we know that you run the support group, and also you are high risk, and still you are currently working as a paramedic. Has this limited you in some way? And also talk to us about the support group that you run.
Okay, so yes, it has limited me, because from about when I got sick mid-June to, I'd say, about into August, I couldn't fulfill my duties, because I wasn't well. I can still feel 2 months down the line, you're still not well, because at night you still have, from 4 or 5 o'clock, your chest starts blowing up. You get fevers, you get inflammation, you get what they call urticaria, which is the rashes and stuff, headaches as well. So it was quite difficult, because I'm someone that just get up and go, and if somebody needs help, I need to be there. So working for Vodacom, I'm the on-site paramedic there, and with us not having to be at work, my paramedic duties were basically confined to our community. And I think that was quite scary when I started going out, and even my bosses said to me, you shouldn't be out there, you should take care of yourself, you should know better. But I think, being the person I am, I just want to be out there to help everybody, and see where I can. About a few weeks ago, I was called out to have a look at a few patients. Now, this family had COVID. The entire family had COVID, and it was I walked in there and I didn't wear my mask, and I said to Dr. Kirsten and Dr. Rustin, you know what? I've got immunity. I'm just going to walk in there, and I'm like a superwoman, And they said to me, geez, you must be careful, because as you get COVID, yes, you got the antibodies, you got the T cells, but as you're going through that 30 days and the next 30 days, your antibodies start waning down. And I said, okay, you know what, I understand. But like I said, when I seen this family, it was sad. It was scary to see that, they had a janaza recently, and then because everybody came to the house, they were infected. The entire family was infected. So it's like 5-6 people in one household.
Yeah.
So that night we had to admit the old man. He wasn't doing too well, and I think he's still in ICU 3 weeks later. So that was quite scary,
Shana, I wish we could go on and chat about this, and you've got lovely stories. We want to bring you back, but quickly, the details of the support group that you do, that you are partaking in, give us that and how people can contact you.
Okay, so what we've done in our area, we cover Bosmont, Maritzburg, Florida, Delray, surrounding areas. One of the anonymous donors from Vodacom sponsored some oxygen tanks. Gift of the Giver sponsored PPE and pulse oximeters, stethoscopes, everything that we need. So what we do is we provide patient support for our COVID patients in our areas, right?
Okay.
With the doctors, with paramedics, and with physiotherapists. So we've got this WhatsApp group where people can join. Obviously, we'll ask you questions before we put you on the group, and then we help you manage the symptoms and your day-to-day journey through COVID. Because sometimes you're alone and you just need somebody to talk to, or somebody to say, I've got oxygen, I'll be there now. Or I'll go pick up your medication and come drop it. So that's the service we run in our area. So if anybody wants to get hold of me, you can get hold of me on my cell, 076 011 9777. And that's for any COVID patient support, and generally any medical support you need in our surrounding areas.
Great stuff. We will repeat Shana's number a little bit later on. We could see how COVID-19 has affected you and your spirit, but it hasn't killed it just yet. Shana, to you and the rest of the guys in the front line, all the best. May Allah continue giving you that woman strength, a superhero strength to keep going. And we will once again repeat that number. I know that Shana has a long list of CVs, on a long list on her CV. She also is part of the washing and shrouding of female bodies for the Muslim Janaza. So please be in contact with the various activities she's involved in. Shukran, Shana. Till we chat again, all the best. Assalamu alaikum to you.
Shukran wa alaikum salam.
There you have it. Female, the support group, the women paramedic, the washing and shrouding of women janazas, and just, endless sort of stuff that Shana gets up to. We will give you her details a little bit later on as well. But stay with us. We continue with masks or not just after this. Assalamu alaikum, welcome back, and don't go anywhere as we really get into this discussion of masks or not. And what are masks really there for? I mean, it's been going now since March, masks in March. The argument of, first wearing it, then not wearing it, what type of mask are you wearing, how to wear it correctly, what to do when you're not wearing it, and more. But first, we have a special video by the World Health Organization and masks. Who wears them and when? Take a look. Now let's talk to our specialist doctors, Dr. Chunara and Dr. Gowden, online via social distancing. A very good evening to you, Dr. Gowden, and thank you so much for joining us.
Hello, how are you?
Good, thanks. And of course, Dr. Salim Chunara, a urologist and chairperson of Masks for All in Africa campaign. Thank you and shukran so much for joining us. Assalamu alaikum.
Walaikum salam wa rahmatullah. Thank you very much for having me. And
Okay.
salam to your viewers as well.
A pleasure having you with us, and thank you once again for your time. Let's quickly look at Masks for All campaign. Firstly, Dr. Chunara, tell us about this organization and how it was initiated and what are the aims and objectives currently.
Yes, thank you. So the Masks for All Africa campaign was initiated by Professor Shabir Musa. He's a guy basically who works at West University, part of the community health department. And, it was on a WhatsApp group, and a few like-minded doctors and other individuals, not in necessarily in the medical field, decided to take on this initiative. And so we sort of set up this core group, guys who drive the whole campaign. And then basically we set up WhatsApp groups involved in the 52 districts in South Africa, encouraging individuals to take part in their areas, in their local communities, inviting women. And initially started off with women just at home sewing masks. And the idea was to gather all these individuals, help out with donations for fabrics, and get these ladies with sewing machines while they were in the lockdown to sew masks and then distribute them in the needy areas in their respective communities. So we tried to sort of do a national thing with a coordinating body, that was running it from a central position, and then the 52 districts taking it upon themselves to run their own programs.
Dr. Chunara,
Sorry.
No, you may go ahead.
Yeah.
Yeah, the other question.
Yeah, sorry. So when we started off, it was also part of advocacy. So we had quite a lot of community health specialists involved in our group as well. So they were lobbying, departments and government as well in terms of helping them write policies. So the initial was advocacy. We were trying to promote and advise on the importance of using masks, what type of masks, etc., etc. And then apart from the advocacy side of our organization, there's also this other side, which was now to promote the delivery of masks to an individual in need, with the whole chain, from fabric to the sewing groups, and eventually distributing it to the respective needy areas.
Why specifically look at masks? Because there's lots one can highlight throughout this pandemic, whether it is social distancing, whether it's education around, what COVID-19 is about. What specifically stood out about highlighting wearing masks?
Okay, so as I said, we were part of advocacy, education, as well as providing masks. So when we promoted masks, we didn't promote it as an individual aspect, but rather as a collective of importance of hand washing, regular sanitizing, social distancing, and in addition to that, face mask. Our idea of face mask was that it was something that people would require. It was an object that they would require, So social distancing they could do just by themselves, and education on how to do it. Sanitizing, they could just use simple soap and water at home as well was good enough. But we felt that masks may not be accessible to everybody. And so we thought, by giving somebody a mask, it was an opportunity also to educate them about the virus itself, about the pandemic, and also encourage the other aspects of, the care that had to be taken to limit the cases in our country, such as you mentioned, social distancing, regular hand washing, and obviously the use of masks as well. And also in our process of education also, we were discouraging civilian population from using medical grade masks.
Okay.
And we also were promoting those that had medical masks to perhaps donate that to medical facilities where it was much more needed in terms of the health sector and healthcare workers.
Okay. Dr. Gowden, if I can get to you and just check in the life of dentistry, you guys went back to work quite quickly. What were the sort of precautions that you had to follow, and how did masks play a role?
So, as you know, before the pandemic, dentists were always wearing masks. We had to, due to the aerosol producing procedures that happen, cleaning, filling, surgical removal. So we did use masks prior to the pandemic. So coming into the pandemic, it was a bit scary at first, dealing with the unknown, these unprecedented times. However, we just got on, prayed, and did what we had to do. So we continued with the masks. We used N95s, other measures like external suctions, fogging rooms before and after, 15-minute intervals between patients. So I think measures were already in place in a dental room, but it was just a little bit of fear just going in the pandemic.
To you, Dr. Jasanda, do masks replace any other preventative measures?
No. So I think it's a question that we get a lot. Wearing your masks, do we not have to practice social distancing and all of that? So the answer is no. We still have to follow the golden rules of COVID. So wash hands for 20 seconds with water and soap, not touching your face with unwashed hands, coughing or sneezing into a flexed elbow or tissue, staying home if you're sick, and most importantly, social distancing. So yeah, it doesn't replace preventative measures.
Because just this week I was having sort of a debate, and I didn't think it was funny, which the next person thought it was. One of his friends or colleagues said, oh, there was this guy who refused to sit next to someone in a meeting. And he said, no, social distancing, go away. But then they were laughing at this guy that was doing it. And he said, and I said, but he's right. You can't just sit in, the rule is social distancing. No, but I had a mask on. So their thing is, no, I've got a mask, I'm good. What do you say to people like that?
So, I think I would go with keeping social distance because people, sometimes become a bit tired of the mask. It falls below the nose or we pull it down below the chin. So I think they become a bit lackadaisy and tired of the mask. Other reasons are like when we use non-medical grade masks, stuff like that. So it's very important to still, maintain social distancing. I think a combined effort would definitely reduce the viral transmission. So yeah.
Okay, Dr. Chinara, let's look at the protection of wearing a mask. What real protection does it offer, and who does the mask protect?
Okay, yeah, that's a good question. So effectively, when you're wearing a mask, it's to protect the other person. So in other words, I protect you, you protect me. That was a slogan that we ran as well with our campaign. When we were promoting the use of the mask, we'd say, you wear your mask because I'm protecting you and you are protecting me. That was an important thing because, look, remember when we're talking here about cloth face masks, right? This is our discussion tonight. We're not talking about medical grade masks. We all agree medical grade masks offer you the protection you require. But a cloth face mask was meant to be used in the general civilian population, where individuals would perhaps come into some sort of contact or some sort of environmental, they will share some space, some space would be shared by these individuals. And we're saying, wear a mask because you'd be protecting the person around you from any aerosols or from any drops that may come out of your nose or your mouth. And that was really the key behind it, that you're protecting the next person, not so much protecting yourself. And if everybody, the important thing about the mask use was it had to be a collective because, for example, if you were in an area and only a few people were wearing masks, then effectively you protecting them, but they're not taking precaution to protect you by not wearing a mask. So for it to be successful and to achieve its objective, it had to be used by everybody in that particular vicinity or that particular area wherein we were encouraging the use of the mask. So I think that's an important point. It is protecting the next person.
Okay, so we ask more pressing questions around masks, the controversy of people actually not wearing masks or some exempt from wearing masks more, and that your questions are included. So please do continue sending them after this short break. Don't go anywhere.
No matter where you live or who you are, each of us can help break the chains of COVID-19 transmission. Here's what you can do to protect yourself and others. Cover your cough and sneeze. Clean your hands frequently and thoroughly, especially before and after putting on a mask and going outside or coming home. Avoid crowded places and mass gatherings. Avoid touching surfaces in public, as they might be contaminated by someone with the virus. Socialize at a distance. Stay at least 1 meter away from others as much as you can, and wear a mask if you can't. If you feel even slightly unwell, stay home. Call your local health authorities and get tested. If you test positive, follow the recommendations from health authorities about how and where you should isolate from others, and receive medical care if needed. Make a list of people you have recently been in contact with. Self-quarantine for 14 days if you have been in contact with anyone confirmed with COVID-19. Make sure you follow your local guidance. Each country or area has its own levels of transmission, resources, and recommendations, and the situation can change rapidly. The COVID-19 pandemic has changed the way we live, work, and connect with others. It is challenging, but together, we can break the chains of COVID-19 transmission.
Thank you to the World Health Organizations and informing us on how to break the chain of transmission. Masks, what is the controversy around it? Can we really wear them if we do have an intense medical condition and we're advised that we cannot? And what are the underlying reasons for that? We talked to specialist Dr. Chunara and Dr. Gowden online. Firstly, Dr. Chunara, if I can get back to you with regards to wearing the masks and some of those underlying conditions. For those that are exempt, do you get up to a point, do patients get to a point that they are that exempt from wearing a mask because of their medical underlying conditions?
Yeah. So, if somebody has got such a significant medical condition that precludes them, in other words, they're going to have difficulty breathing because of a mask that they're going to wear, then, one begs the question that, should they be in a public space where they then need to wear a mask to comply with the regulations of the country at that particular time? Because remember, we send high-risk individuals, stay at home, don't go out unless you really, really have to. But be that as it may, I must say, in our experience, and I've seen this, we distributed many, many thousands of masks to the various areas as well. The fabric type is very, very important, So generally, if you're using a 2-ply or a 3-ply type of fabric, the 3-ply obviously does make it more difficult to breathe through it. But we've noticed that, using a 2-ply mask, even with the filter sort of in between them, makes it much more comfortable. And again, the fabric type makes it more comfortable. So I must say to you that, just off the top of my head, I can't say to you that there's any medical condition that would preclude one from wearing a mask, because you should be able to find some mask that will be suitable for you to wear. You're going to be able to breathe, and that shouldn't really preclude you from wearing a mask. So to answer simply, I'm not going to say that there are medical conditions that preclude that, If you're that sick, then you shouldn't be out of your home or out of your health facility, where you then need to wear a mask.
What about people that have anxiety and issues around spaces, claustrophobic, a medical condition that might exist, because they feel the need to, or they feel that they can't breathe because of them having the mask on?
Yeah. Okay, yeah, so we were faced with some of those situations as well. Like I said, we managed to overcome some of those cases where different fabric types we used. Patient then tried them and realized, okay, I can breathe relatively easy with this one, so I feel okay. In the extreme cases where they were unable to wear the mask, for those really exceptional cases, then the use of a face shield was then highly recommended. Or that's what something we also suggested to individuals to do. I can't give you any hard and fast proof of that, but in the case where the mask could really absolutely not be worn, then a face shield was the next best alternative in that situation. But I must say to you, in most cases, one would find some fabric that would be comfortable. And if you tried a few even at your home and you realize, okay, I can't breathe through this, you almost manage to overcome that anxious feeling or that anxiety. If you look throughout the world, the use of masks has become extensively widespread. And there's very few situations where you find people really can't go out and cover their faces. Even if it means just wearing putting a scarf around your face, or even one of these, one that the cyclists use, this bicycle, the cyclist buff that you use as well. So, I mean, there's so many alternatives, and one is likely to find something that you're comfortable with, that's my feeling.
Okay, so Dr. Gowden, I just want to reach out to you. Being within the medical industry, and I know as surgeons, they have to wear masks and, sometimes even the full PPE for hours at a time. And, people are claiming because they can't wear a mask because it's restricting their flow of air, breathing, and then it affects their brain. And here we have highly intelligent medical workers needing to be focused during surgery. What is your comments around that? And also from the dentist point of view, where they would have needed to wear a mask way before COVID-19 on a daily basis?
So I think, as said before, due to the fact that we've been using it through dental school, you've basically adapted to wearing a mask. It becomes second nature because you're dealing with saliva, you're dealing with aerosols that are created. So I think it's very on hot days it's a bit difficult, but most of the time it's okay. We've managed to deal and just become one with the mask.
Let's talk about the fears of being a dentist. I know you're wearing a mask, and sometimes you guys go to the point of wearing face shields, but working so closely with the patient in their mouth. Any fears and worries around that? How do you pay extra precautions, when doing your job every day?
Yeah, so I think there is fear now, during the pandemic, but we work with, high volume suctions. Just companies have developed amazing tools that help us alleviating all of that aerosol creation. So it just makes us get a little bit easy when doing certain procedures. But yeah, it is a bit scary, but we pray and, like I said before, just continue to serve and fulfill.
Dr. Junara, if I could get back to you quickly. People are claiming, and some messages are coming through around wearing the same mask every day, people contracting flus and colds because of wearing the mask. Is there any truth around, the sniffles or, it creating sinuses? What do you say around those questions?
Yeah, no, again, it's a good question. The way we were advocating the use of the mask as well, again, like I said, just giving somebody a mask was one thing. But what was very important was the education behind the mask. So we would give them a little leaflet to say how they should use that mask, how to wear it and how to remove it, and also how to clean it. And ideally, we would try and make it a point to give an individual 2 masks so that they wouldn't have to wear the same mask every day. They would wear 1 mask, wash it in the evening, dry it out, and then they had one for the next day. And so they could continue the cycle. Wearing a clean mask every day is the ideal situation. Obviously, if you're going to wear 1 mask for days on end, naturally you're going to trap secretions in there. You're going to trap a bit of saliva. You're going to trap lots of things in that mask as well. So not cleaning the mask is a decision that you're going to take as an individual. It's not a very smart decision, and I think it can lead to other issues. There was a study I read about today as well, where I think it was in England or France, I can't remember where it was. They discovered a whole lot of bacteria and fungi on the masks of children. So the thing is, if the mask is not clean, it's going to lead to problems. I think that is obvious. The other issue which is interesting here is the allergy related to masks. So when you talk about sinuses and you talk about blocked nasal passages, etc., that can be affected, especially if somebody is allergic to a certain type of fabric and they got an underlying allergy. That can give rise to irritability to the nasal passages, and it can give rise to congestion, and they can have the sniffles and post-nasal drip, and whatever else can go with that. But again, it is a bit of a trial and error. So, you may find certain fabric you may not agree to, and certain fabrics you may agree to. And there's such diversity out there, and there's so many options available that, somehow, it's just not even an excuse that you can't wear a mask. You can overcome it, certainly. just if I can just quickly make a comment about what you asked Jacinta about, operating. Obviously, myself as a surgeon as well,
Yes.
we sometimes spend hours in that kind of gear. And the more complicated thing is when we're operating on COVID patients, because you literally had to have an N95 with the face shield and all this extra, gear on you. I must say it became very, very tedious. For some, I think the body adapts, and like Jacinta said, you get used to it. And I think that's what happened. You sort of spend hours there, you're so distracted with maybe what you're doing for the patient that you kind of forget that, you sort of caught up with all those masks and everything else. But I must say there are many, many times in my rooms as well, I sort of just take a breather, remove my mask and sort of breathe free air in,
Yeah.
Otherwise you tend to get a bit hypoxic and maybe...
Yeah, no, so it doesn't make sense for others to be complaining they cannot breathe or they cannot think because they have this mask on. You guys have to walk around, be in one confined area with it for hours. Okay, we have to wrap up. We've got a minute or two. There was a question that I had on ventilators, but I think I'm going to just bank it for our next show as we learn about surviving COVID-19. But quickly, Dr. Chinara, in your last words, the correct use of wearing a mask.
Okay, very important. The very important is to first of all make sure you sanitize your hands very quickly.
Okay.
Again, before you place the mask, make sure the mask covers your nose and your mouth. Avoid touching the inside of the mask, and also when you have the mask on, avoid touching the mask itself. Make sure your hands are clean. The mask, your mouth and your nose are the route towards where the virus can get into your body. So keep that area clean. When you're taking off your mask as well, sanitize your hand first. Remove the straps on the back of your head and remove the mask, and then obviously have that mask washed, and until you're going to use the next mask as well.
Okay, and Dr. Gowden, from your side, what message do you have to those individuals that are coming to dentists? Because I see now that they give patients extra protection, whether it's, I think it was a shoe covering I had on when I went to the dentist, and what they should know when they are going to visit you guys. We need to wrap up.
Okay, I think initially it was a bit scary for patients to come in because they felt like they were walking into COVID Central, dealing with other patients. They thought that, the aerosols are just all over the place. So, they see the precautions that you take. They see the extra effort that you go cleaning in front of them, fogging and aerosol removals, all of that. So I think they get a bit comfortable towards level 3. It became a bit better. But yeah, I think they should just have comfort in the sense knowing that, measures have been taken to make sure that the environment is absolutely pristine for them to receive treatment.
Thank you, Dr. Jacinta, and a big shukran to you, Dr. Salim Chinara, for your time, our specialist on air. Connect with Masks for All Africa. It's a great campaign to get the necessary information and go online to see where there's correct information. Follow the medical workers with what they are telling you and your doctors, not what hearsay has to say. Next week, we catch up with those that have survived with COVID-19 and life after COVID-19. What is that currently like? More on Health Matters. Catch our repeats on Wednesdays and Sundays and on our YouTube channel. From myself, Hawa Solomon, and our team, wassalamu alaikum and goodbye for now.